I feel like there's a lot of benefit that people can get from psychiatry that in physical medicine we just don't have the ability to provide. It's not hands-on, but it's kind of emotionally involved kind of treatment, which benefits patients and makes them more functional. That's our goal in psychiatry, is to make people functional and live healthy and productive lives. I started in internal medicine, but then I changed to psychiatry because I felt that I wanted to get to know my patients better. You can't see mental health problems automatically, so that becomes an issue where people are suffering and suffering in silence. The number one thing in all of psychiatry is to build rapport with patients and to understand where patients are coming from. So we ask a lot of questions about their school life, their home life, get to know what they're interested in. Sometimes we just talk about what they're interested in to try to build that rapport. A lot of times we play referee between children and their parents, but I always allow my patients, with just the child, to have a voice. And that usually allows the patient to understand better where their parents coming from, but it also allows them to have a voice later on when I speak to them privately about stuff and what they thought about what their parents said. The most common conditions we treat are depression, anxiety, bipolar disorder, but we also treat eating disorders, autism, OCD, conduct disorder, oppositional defiant disorder. We focus on systems of care, which involves basically understanding where patients and their families come from and what their goals are, and we work towards that. I don't try to fix things that don't seem to be a problem in the family setting. And you have to be culturally appropriate for patients and their families. I mean, some families are willing to do certain things and not others, or they have certain rules, and we have to accept that. It is rewarding to see kids improve over time and become more functional, be able to go to high school, be able to go to college, be able to attend sporting events and events with their families and be comfortable doing that, end up graduating college, getting jobs, being productive, becoming parents themselves. I mean, that's all very rewarding. I really enjoy working with this community. I think Joe DiMaggio is very supportive of families and patients. They try to make things as smooth as possible during hospitalization and also in their outpatient setting. We try to be available to patients and families. We have a lot of resources to offer families, which is fantastic. A good doctor is someone who listens. They don't have to be the most advanced person with the greatest technology. They just have to be willing to listen and understand you. And if they understand your needs, they're better able to take care of you.